This morning we've got a slightly different format. So I'm going to be doing a short presentation for you on storytelling and telling your story. For some of you, this will be old hat, and you'll be very, very used to telling your story in the health setting. So it might be a bit of a refresher for some of you, and for some of you it might be really brand new. We're going to try and keep the presentation really short and sharp with a little bit of time for discussion. And then when the presentation's finished, and please feel free to put any questions into the chat, and we'll try and cover those off as well. But when we finish the presentation, by that time we should have Melissa joining us, and you'll move into your regular consumer conversation, community of interest conversation, the way that you normally do it. I can still see a few more people popping on. So maybe, Suzanne, if we move to the next slide, which I've done something really tricky, Suzanne, with my monitors. I have like the second monitor set up, and the share screen has gone up on there, which is fantastic, which means I can see everybody's faces at the same time as I can see the presentation.
Nice work, you.
I know. How did I do that? So I would like to acknowledge this morning the custodians of the land on which we're meeting. I'm coming to you from West End in Brisbane, the land of the Turrbal and the Yagara people. And I'd like to acknowledge elders past, present and future. And it's really fitting, I guess, that we're talking about storytelling today when we have the First Nations people have such a rich culture of oral history. And really, we draw a lot of inspiration from how you tell your story and how you pass on information from First Nations people. So if we move to this next slide, this is what we're going to try and cover off in our presentation really quickly. So we'll just do a little bit about what is storytelling and storytelling in health. What happens when you tell your story? What's the benefits of it? What's the purpose of it? And a few things to think about when you're telling your story to make sure that, that the story has impact, but also that you're keeping yourself safe when you tell your story. We can go to the next slide now, Suzanne. So storytelling is actually something that's, it's actually really natural to human beings. Our brains are wired to listen to stories. And in fact, one of the things that we do when we listen to stories is that we actually retain that information much better than if we're listening to a lot of information just even in dot points or bullet points or as a string. So, there's a reason why we have the TED and the TEDx presentations are so successful and why they have that format, because it's really based on storytelling and that narrative approach. It helps us to retain information. When we remember it, it means that we can relate that information better. And you'll know yourself that when you've heard a really good story, it's easy to be able to tell somebody else what that story was about. So it's a way of sharing that information and passing it on. And when we come to health stories, it's a really powerful way of sharing your experience. And it's a great tool for sharing with organisations what your experience is like from a perspective that they might not have considered. So it's a great tool for change. And in fact, I really believe that storytelling is one of the only things that actually has true and lasting impact. So that's just my partner walking behind me. If we move to the next slide, storytelling in health. So when we tell our story in the healthcare setting, we can actually show some of the problems that we've experienced. We can share those problems. So you know yourself that you might have come to the health consumer arena through some of the issues that you've had in a healthcare setting. So sharing those things can be something that really shares with the organisation the areas that they need to focus on to improve. It can really improve understanding about particular issues, sharing that perspective. And it can be a really great way of reflecting on the things that you've been through yourself as well. And by reflecting on that, it might help other people who are going through that experience to also reflect and see what their journey is like in comparison, or to understand their journey a little bit better. So one of the things that in a project that I've worked on recently, one of the things that we did was actually get a group of consumers together to share their health journey. And then we were able to use those health journeys as a storytelling process for some of the bureaucrats and health administrators that we were working with. And it had a lot of impact, even on paper, sharing those journeys. So we can do it in a lot of different ways, storytelling. If we move to the next slide, Suzanne. So why use storytelling in the health setting? And I've shared here one of the cartoons that we had developed as part of a youth peer worker project, where we also used a lot of storytelling. And I think one of the really important things is that that lived experience really helps other people to understand what it's like to walk in that person's shoes, what it's like to go through the health system from that particular perspective. So it creates that shared experience that everyone can then relate to. And it moves people from a really, perhaps an intellectual point of view about an experience to a much more emotional point of view about an experience, which I think is when you start to get that shift and change in people. So it is a really powerful tool to help people understand your consumer experience and your perspective. And if we use it effectively, it can really bring about change in the health system. So it's a really important tool for all of us as consumers to get on top of. We go to the next slide. It's really important to understand your why. So effective storytelling, we always have a point to it. So it's got to have a why at the end. Why am I sharing my story? What is the action that I'm looking for at the end of this? So it's also important to be succinct. You don't want to be like rambling on with the story. You want to have a really clear way of telling, a clear progression of telling that story. And you can think about different ways to do that. So you might have had a particular experience, but perhaps for a committee or a group that you're on, you may need to shift the angle of your story for it to make sense for that committee, for it to have the impact that you're looking for. So sometimes it's about actually looking at your story and going, how can I reshape this to fit this situation, and to have that impact at the end that I want to have happen. So that call to action at the end of your story is really important. What do you want people to do? What do you want them to take from your story? What action are you looking for? So highlighting the key messages that you want, and you might be able to actually use a storyboard mechanism to brainstorm that for yourself. And we have some templates like that we can share, where you actually just sketch out how you want to tell your story. Trying to keep them a little bit short is great. So I think we've all probably experienced looking at a video on YouTube, and once it gets past that 5 to 10 minute mark, we can start to kind of fade a little bit. If you can keep it short and to the point, that really helps. Or if you can think of the rule of 3, where you're having 3 main points that you want to get across and keep going back to those points. So those key messages then will lead to that call to action naturally, and then you'll have framed for yourself actually a really nice storytelling process. Okay, so if we move to the next slide. So when you're telling your story, it can be a really vulnerable experience. And I think that's a really important thing to remember. So you're in charge. You don't need to tell more of your story than you want to. So you can decide on how much of your story you want to choose. You can decide who you want to share that story with and when. You can decide what you don't want to share. So you shouldn't feel as if you're being compelled to share your story, or that you have to share every single aspect of your experience. So it's really important, I think, to acknowledge the emotional toll that sometimes goes with being a health consumer. So I've heard people talk about storytelling fatigue, and sharing your story so many times can actually lead to that. Trying to think about what you do and don't want to share can help lessen that a little bit. So, and I guess when you're telling your story, if you're feeling emotional yourself, then you should feel as if you can stop and leave it at that and not have to continue. I think to make sure that you're always keeping yourself safe is a really important point. Your story might also affect other people who hear it. And they might also feel emotional when they're hearing your story. So sometimes we can think about, having a content warning at the beginning if there's upsetting or graphic information that you want to share. The evidence base around trigger warnings is interesting. So I know that trigger warnings are used quite a lot across the sector. The research on trigger warnings shows that they probably actually don't work that well. But I think if we think about a content warning, then that at least gives people a little bit of a heads up about what might be in front of them. And it helps us also to be able to share information where people might want to, maybe where they can access help, or if something's really upset them and that they find that they need to access support as a result of that. I think telling your story in a way that's kind to you and safe for you will probably make it safe and kind for others as well. So I think it's important to keep those things in mind about how you keep yourself safe, not feeling compelled. If it's feeling like it's not a good experience, then stop and don't continue. Hopefully the work that you've done about thinking about how to share your story will stop some of those things from happening. Okay. So I've shared here some really great resources, and when we share this out, you should be able to connect into these links. But these are some resources that I've used before that have some really good examples of using stories. So if you're not sure about where you might use your story or how to go about pulling a story together based on your experience, then hopefully some of these resources will help you with that. Helen's mentioned, it's worth thinking about how often you want to tell your story. And I think that's a really great point. So like I said, telling your story can be quite fatiguing. It does have an emotional toll to it. I think any of the work that you do as consumers can be, at the end of the day, when you've been on a committee or been on a group, it can be quite exhausting at the end of the day, having to share your story. Knowing your audience, Carolyn, thank you, is really, really important. So thinking about that reframing, how do you make sure that what your, that the audience that you have, that you're telling a story that's going to make an impact on them, that it will make sense to them. When you have a troubled story to tell government, Janelle, I think, yeah, that's an interesting one. So I don't know if anybody maybe wants to share their experience of doing that. I've certainly had some different ways of approaching that. So one of the things that when it's been a difficult story to share is to think about whether the person who's had that difficult experience is the person who should share the story. So that's one thing to think about. So keeping yourself safe again, whether there's another way of sharing the story that doesn't feel too emotional. If you're concerned about the impact that it might have on government, that it's a negative story for government, I actually think that what I've seen is that telling those negative stories has the opposite effect a lot of the time, where it shares that issue that perhaps the government hadn't thought of before, or perhaps a service hadn't really considered that perspective, and it's led to actually quite a lot of change. I think maybe that that sense of feeling emotional or feeling angry can be something that we have to negotiate when we're telling those stories as well. And that has a lot to do with the audience and the setting where you're telling your story.